Welcome to Trailblaze, where I introduce you to some of the innovators and game changers that you should know. Over the past 2 decades, as a founder, investor, and host, I've had the privilege of meeting incredible individuals that are having a positive impact on the world. Join me as I sit with these leaders and innovators that are trailblazing their own path as they share their stories of the resilience built and the wisdom gained along the way. Enjoy the episode. Dr. Isaacson, you have dedicated your career to solving the incredibly big and most important human problem, that is of how do we deal with longevity of our brain? How do we make sure that as we fix all these other health problems, that we're going to be aware and around to enjoy it and live a happy and healthy life? Yep. It's been a long journey and there are many aspects to it, and we're only a small part of the way there. What was your personal inspiration of picking this path to solve this, what is maybe the biggest problem facing humanity?
Yeah, so, in terms of like a three-legged stool, I look at longevity as like lifespan, how long you live, and health span, the quality of life, that you have with different medical problems. But brain span is something that people just don't think about.
Right.
And, you kind of alluded to it where, if people are living longer, then they better be living better, and there's no better way to live than with a healthy brain. So, I kind of dropped into this, I think, really because of my family history and my family members. My Uncle Bob was diagnosed with Alzheimer's disease when I was in high school. I finished all my training, rip, rare, and ready to go, 15, 20 years later, whatever it was. And my dad's first cousin was sitting next to me at a wedding and kind of repeating the same story over and over.
Right.
And, everyone said, oh, she's fine. It's just normal aging, senility. Primary care doctor said, oh, she's fine. It took her 4 years to get a diagnosis. And that's
Wow.
my own family member. And the first, my great uncle Bob, there were no treatments when he was diagnosed back in 1995. So I think I've seen it personally. And, Alzheimer's disease begins in the brain decades before the first symptom of memory loss begins.
Decades.
And that leaves a lot of time to make brain healthy choices and to, really grab the bull by the horns and make some changes in one's life to try to prevent or delay at minimum cognitive decline. So I think early, exposure from a family history perspective. Also, my brother's a neurologist. He's 13 years older than me. He's the smarter one in the family and the better looking one. I don't know if this is a podcast
Right,
or a
yeah.
video, but I'll take either. You're on video.
Both.
Okay,
Yeah.
perfect, great. So maybe I'm not the best looking one. But my brother's a neurologist, 13 years older. I was in kindergarten when he was literally doing neurology training, and I picked up one of his books, Neuroanatomy Made Easy and Understandable. And I was the dork, years later, reading his textbooks on camp trips to Dollywood and, from New York to Tennessee or whatever. So long story short, I think that's just kind of permeated. And when I realized that this disease develops silently in the brain for decades and that there are modifiable risk factors, I said, this is what I have to do. And I changed, I shifted, and now I have a very small practice that focuses on people with cognitive changes, the earliest form. But really, I'm seeing people in their 30s, 40s, 50s, 60s, and beyond to try to, get ahead of things. And that's, prevention is a cure. And the only way to prevent Alzheimer's disease is to start early. And more so, you can't prevent Alzheimer's in everybody. 4 out of every 10 cases of dementia may be preventable if that person does everything right. And that's awesome. That's a big headline. And I think most people aren't aware of that. But, half of cases or more, someone's still going to get dementia. But can we delay it by 6 months, 12 months, a year, 2 years, 5 years? And if we do that through lifestyle changes and other recommendations that we can do today, and then a blockbuster drug comes later, well, then through that person's own devices and through our medical care, we've then prevented the person from getting Alzheimer's disease.
I mean, I think it is shocking to hear you say meeting people in their 30s and 40s to deal with this.
Oh, yeah.
I mean, this is something that I don't think is on anyone's radar in their 30s. So there's a huge lack of awareness. Yeah. When you say this is a silent disease developing in the brain decades, or no one would anticipate in their 30s. So why does that happen?
Yeah. So, even with cardiovascular disease, I think people have a heart attack or stroke in their 50s, 60s, 70s, or 80s, or 90s, and same thing. Disease of the blood vessels, atherosclerosis, hardening of the arteries, the inflammation of the blood vessel walls also starts decades before. Right. And people understand that. We can do cholesterol tests.
Yeah.
We can check, blood pressure and blood sugar, diabetes.
I mean, we're expecting those checkups on our annual checkups, cholesterol, blood pressure. I mean, these people you're expecting those.
Exactly.
But we don't expect anything for brain.
Well, and that's going to change. Right. We're waiting. It's coming. It's actually here. It's here today, but most people, again, are unaware. But Alzheimer's disease begins in the brain decades before, begins silently. I think most people don't have any conception that there are certain genes that you can be born with. And when you're born with those genes, your brain is smaller at birth, and that person's brain is at risk even early on. And the take-home point here is that there are early life, midlife, and late life risk factors for cognitive decline and dementia. So just for example, when you're younger, even before your 30s, in your teens and 20s, education. Having a cognitive reserve, building a cognitive backup system, staying engaged, wearing a helmet while biking. There's like eating a healthy diet even while young. The food that a mother eats while pregnant, a maternal diet rich in B vitamins, affects the cognitive trajectory and the cognitive outcomes of the baby decades later. Right. So this is a life course disease. Right. And whether you're thinking about early life risk reduction or midlife, high blood pressure, high cholesterol, late life, hearing loss. Hearing loss, 8% of dementia cases are attributed to hearing loss. Get a hearing screen starting at age 50. If you have hearing loss, don't be ashamed. Just put a little tiny little hearing aid in that will keep you engaged. It'll protect the brain. So I think we have to start.
People aren't aware of any of these things today, right?
Zero.
So there's got to be a huge amount of education that goes on because we're all thinking about the risks of cardiovascular disease, the risk of diabetes, risk of cancer. That's one, but we don't think about this at all throughout our lifetime. Now you're talking about all the way back to the womb. This matters. All the way back to a pregnancy. It matters. Mm-hmm. It seems like a Herculean lift to transform the way people think about this. Yep. And you've embarked on that mission. So you've got something really driving you. What is it?
I'm curious. I would say it's curiosity. I didn't kind of start out my career thinking I'm going to try to prevent Alzheimer's, the most costly disease that our society faces, among the most devastating. I don't want to say is it cancer, is it Lou Gehrig's, ALS. I don't want to compare the terribleness of diseases, but Alzheimer's sucks. It is just a terrible disease. I've seen what it does to my family. Yeah. I mean, I don't know how this all happened, but I don't know. I think in some ways I have a chip on my shoulder. I have the old guard. Now, this is an ageist question because I was a little younger than some of my peers, I would say. I finished college at 19 and med school at 23 and kind of just started out and went right through med school quickly. But I think I've had a contrarian but accurate view of how and when to intervene about Alzheimer's. And I think the people above me, the elder statesmen and women maybe kind of thought,
dismissive.
What is this kid talking about? He can't do any nutrition, I guess I should be cautious. This is being recorded, but, we had maybe a former president that was treated with, for Alzheimer's disease who passed away years ago. And, when I talked to that person and at a conference and said, "Oh, what do you think about this? What do you think about that?" And he said, "There's no evidence." And then he walks away. Right. And a decade later, his name is on papers about nutrition and about brain health and how what you eat can impact the cognitive trajectory and your Alzheimer's risk. And I guess I was a little early. But I think what happened was I got a lot of criticism, a lot of tomatoes were thrown at me, but that only strengthened my resolve. And it took a while. Had to pick myself up and get back up and from the critiques. But we've proven our thesis as best as we can at this time. Still have a ways to go, but I think I'm driven because I know that we can do this. I know that we can change the conversation. I know that we can improve lots of people's lives. And the next goal is to scale this and to truly help, tens of millions of people rather than the smaller group that we have so far.
Even though you got an incredible head start, starting very young with your research, you also have found, especially in recent years, the time to start a family, build a family, have a beautiful love and relationship, and contribute to your community in so many ways. The balance of achieving that with everything you have going on in your research, always founders struggle, and I certainly in my career struggled with this. Yeah. How have you been able to find balance in your life?
Oof, that's you're a hard question asker. Thanks. What I would say is I did not have balance for a very, very long time, and I'll just be very transparent about that.
Did you know you didn't?
I know. I was aware of it. I didn't take a vacation. I went to 6 years of college and med school altogether, and I did not take a vacation for years. Okay. I never had more than 2 weeks off until I was until I was 23 years old. basically. Actually,
So you had graduated from that school.
Actually the summer before I went to, actually that was, 3 weeks. Yeah, I took 3.5 weeks off. For 5 years, I did not have anything longer than a 1 week vacation. And every extra minute I had, I would go to the NIH, or I would go to Cornell, or I rotated at Beth Israel Deaconess at Harvard. And I never stopped to smell the roses, I guess, as some would say. Then I had to keep going because, you know, I was at Miami, and then I recruited to Cornell, and you get kind of locked into it. And I guess what I would say is I work hard, play hard. And when I was on, and when I was off, I was off.
Yeah.
And just like when I was on call, I was on. And then when you're off call, you're off. And when you take that Thursday night call, it means you have the weekend off.
Yeah.
And I would go home, I would sleep, and then we would do everything I can in like a compressed period of time. So I guess what I would try to maybe suggest is, try to stay present. When you're off, try to stay off. If someone can cover you or be there for you or help, try it. The problem is that there are certain things that only founders and only certain people can solve. So, I'm struggling a little bit with this, but I would say in the most recent years, recently I left academia for the first time. For 17 years, I was an academic physician and, different medical schools. And I would say, and I'm not saying I'd strongly advise this, but I think at a point, there's actually a quote, because what I do is I listen to podcasts and I try to learn business. And there's a podcast.
and you're in the business of getting grants now too. Now you're an expert at getting grants.
Exactly.
Barbara, can you get one for me?
Let's talk afterward. So there's this Josh Koppelman, who's a VC, who's I've listened to his teachings, and he said something once, and I hope I don't mangle this quote, but he said, there's a period of time in your life where it is the after the at symbol time. So I was at med.cornell.edu, or at bidmc.harvard.edu, or at whatever. And then there's another time in your life when you're the before the at symbol, and it's you and your name. And it took me, 17 years to say, wow, I can be the before the at symbol, and I can
that's awesome.
Leave academia, but still be academic.
Yeah.
I'm still lecturing. Yeah. I'm still getting it. I actually kind of can't believe it. Nothing's changed. I don't have the fancy Ivy League whatever anymore, but it hasn't changed. I have a company now.
Yeah.
I treat patients in a very specific practice that's really high touch and something. I go deep on patients and really enjoy it.
Well, and the digital health startup. It's so exciting.
Yep. And it's fun. And then I have the research. And actually with the research, I actually don't take a dime from my research. I'm not paid. I do all my research for free. I basically, volunteer my time. But in the past, when you work in an academic job, you have like so many things going on and so many hats and so many roles. But the way that I've been able to stay balanced and start a family, for better or for worse, is I had to leave academia and take control of my own time. And I had to say, I'm going to be okay without, having the shingle that says X on it. I'm going to be okay, and I'm going to take a risk. And, I'm at the Institute for Neurodegenerative Diseases now in Florida, and, it's not Ivy League, but it's still working.
Yeah.
I'm still asked to quote in the media, and I'm still applying for grants. And I think I had to take a big risk. And if I didn't do that, and leave the, constant struggle and grind of New York City, even though New York was an amazing time in my life, I couldn't have done it. So I say the
choosing what's important and making the time for it.
Exactly.
What's important to you and making the time for it.
Yeah, critical. Risky, but critical. Yeah.
It's really interesting and an amazing lesson for founders, having the conviction that what you're doing is going to lead to a positive outcome and have a positive impact on people, and continuing to push forward in the face of unbelievable criticism. Yeah. That's really what Trailblazing is, and you've done that. When you were in your 20s and people were dismissing you as the kid that doesn't know what he's talking about. And as you say, I had tomatoes thrown at me and I had to get back up. Yeah. What was in your heart and in your mind that got you back up and kept you going?
What kept me going, I saw the impact in the patients. You had a 52-year-old guy, amazing guy, I won't say any names. He had a 4-year-old. He had a 4-year-old child. And people said there's nothing you can do. And, fine, we put him on the drug. It's early onset Alzheimer's. This is a tough condition. We used the typical drugs, but we changed his diet. We had him exercise on a regular basis. We had him, he was up on his phone. He was confused. He was staying up late. We got him off the devices. We got him on a regular schedule. We prioritized sleep. We got him away from sugar. We got him, green leafy vegetables, berries on a regular basis. We hit him with every single thing that we thought could be brain healthy, but maybe didn't have the perfect evidence, but was safe.
Okay.
And what happened to him was striking. Like he actually, things slowed down. And then we put him on one of these anti-amyloid drugs. This is in 2006. This is like a long time ago. Now we have 2 FDA-approved anti-amyloid drugs, which are IV, whatever. And for the first time in a phase 2 trial, I saw the person get the drug. This was not a placebo effect. He could tie his shoes again. He drove to the clinic. He stopped driving. And these are crazy stories back then. But I saw it with my own eyes, and I said, I have to do this. And 52-year-old guy with a 4-year-old little boy, right. That's what pushed me.
It's worthwhile, right. So there was a motivation having a positive impact on everyone, but also that you saw a path to actually seeing some real results.
Yeah.
But what you just described there are just a whole lot of things about any healthy lifestyle. So if you had to break it down for people, what are the 5 things that Richard says I need to do right now to make sure that I still know who I am when I'm in my 90s? God willing, I still know who I am in my 80s and 90s and 100 and beyond 100.
Yeah. So you just happened to ask me my least favorite question, so thank you. No, the reason why I say that is because there really is no one perfect, one-size-fits-all approach to protecting a person's brain. And so I want to make that clear. If I had to choose the top few, this is hard, but exercise on a regular basis is probably, or really is, the most evidence-based thing that a person can do to protect their brain health over the long haul. Exercise, literally, it loosens up, and colloquially speaking, this pathologic protein called amyloid in the brain. And exercise on a regular basis, cardiovascular, strength training, flexibility, balance. If you have low muscle mass, build up muscle mass. If you have high body fat, as the belly size gets larger, the memory center in the brain gets smaller.
Really directly correlated.
Directly correlated, and this is a little worse with women, but also not great with men neither. And you have to really not just go exercise, but it has to be a personalized exercise prescription based on the specific areas that you're trying to address. So exercise is critical. It releases hormones. There's a new study by Dr. Rudy Tanzi about this chemical called irisin, and maybe that what breaks up the amyloid. Whatever the basic science, whatever it is, it works, and exercise is critical. But you can't just exercise and think everything's going to go away. A person, for example, is not having adequate sleep. The trash disposal system of the brain happens during sleep. And sleep's tough, and with devices and all these people texting and just nonstop
always on
digital
just
world.
Always on.
Yep. Yeah. You got to quiet the brain. Going to sleep the same time every night. Wearing trackers. I'm like totally tracked. I got the strap and the ring and the watch and the and it's helpful because at least it makes you accountable, and you can track patterns over time.
These devices work, in your opinion?
Any device is as good as what you make of it, and no device is perfect.
The data is real.
The data are real. Again, no device is perfect, and I have nothing to disclose. I don't have relationships with any companies, but the Whoop device is something we've studied. I've used the Oura Ring. I like it for sleep. I wear Whoop still today. 6 years later, I was one of the first people to wear it. I use a Garmin to track other options and to track my running and different times. So I actually wear multiple things, and that's what's helpful for me. But during sleep is when the garbage gets taken out, the glymphatic system and the amyloid gets taken out. So if you're just burning the candle at both ends and you're exercising and thinking you're going to prevent Alzheimer's, you need to do a little bit of both. Yeah. And the same thing, you are what you eat when it comes to brain health. And a Mediterranean-style diet is clearly the most evidence-based. Green leafy vegetables, fatty fish, wild salmon, lake trout, mackerel, herring, albacore tuna, sardines are really high in brain-healthy omega-3 fatty acids. A little detailed, but DHA and EPA. Problem here is, again, I'm giving general advice, which I hate to do, but different people with different genes need to eat differently and do different things. So certain people really need to attend to these brain-healthy omega-3s. Other people, it may not be as important. Diet, exercise, sleep, reducing stress, really kind of the hallmarks. And if I had to say, emotional health and stress reduction and having a plan and a method to mitigate stress, I think is critical. But if I had to say the fifth thing, it's vascular health. And what I mean by that is seeing a doctor on a regular basis, knowing your your numbers. Everyone needs to know their numbers. Just like, I don't know, if you're running a business, you know what your P&Ls are, you know what your burn rate is, you know how many months you have left. Right. Oh, what's my runway?
It's amazing how many people don't know the numbers in their body.
It's like completely striking to me. Like most people don't even know their blood pressure. Like anyone get their blood pressure checked. Anybody. Some people don't know their percent body fat or their muscle mass. Like anyone can get that at any time. So yes, see a doctor, which is critical. High blood pressure, high cholesterol, and high blood sugar. Fast forwards, cognitive decline, and fast forwards, Alzheimer's pathology.
Yeah.
If we can know our numbers, and I think the concept here with vascular health is normal is good, but optimal is better.
Right.
And there's a frame shift.
And you talk a lot about that, actually. Yeah.
And it's really critical because, do you know how many people I see that said, they said my numbers were borderline. My cholesterol was borderline or my blood pressure was
so whatever, it's okay.
Go eat less salt and exercise more. What do you mean? I don't need any salt and I exercise great. It's okay. I'll see you back in 6 months or a year. That's the wrong way, because the slow churn and the burn and the smoke and the fire and the kindling, like, you got to stamp this out early, because borderline levels for decades causes problems. And that's the frame shift. Our medical system, at least in the United States, and I think elsewhere too, is a sick care system. My reimbursement, like when I see a person for prevention, I don't have diagnostic codes. So I had to be innovative and get grant funding and philanthropy, and there's different ways. But I think those are the 5 things. I think it's hard. I wish there was more access. I wish there were more doctors that could be compensated for this, and reimbursements, and doctors could be trained more. And I think it's hard, but seeing a doctor on a regular basis is key.
Well, one of the things you're touching on there that is seemingly there's a huge problem, in my opinion, is just this idea of how do we make it accessible? Mm-hmm. How do we democratize this? So what you described there for brain health is a very personalized requirement. Is all of what all of your research in the past number of decades is pointing to. But we don't have the systems to do that. We don't have the resources financially to do that. Our healthcare system is not set up in any way to do that. So how do we make this accessible for everyone?
Yeah, and I'm a clinician. I'm a clinical doctor. I'm a researcher. Okay, fine. I'm an educator. I was an assistant dean at Weill Cornell Medical School, for a while. But in some ways, you have to have an entrepreneurial spirit to understand how to scale and grow and reach the masses. And I wouldn't say that I had that years ago, but I had to have that, and that had to be an acquired trait. It's not like I could have the time to go to business school. I was like deep in the trenches. I listened to podcasts, like the Masters of Scale and this and that, and I'm doing the best I can to learn. And I realized that the digital solution had to be the way forward to scale. And what we've been working on, and what we did is we applied for an NIH small business grants, SBIR grant is what it's called. And I got couldn't believe it's the highest score I've ever gotten on any NIH submission in my almost 20-year career. We almost got funded on the first try. It was amazing. We made some edits, and we got amazing $3 million to really launch the company called Retain Health. Been a co-investor.
So maybe you always had those skills innately, and you didn't really need to develop them. Maybe you were always. Yeah.
I don't know. I listened to a lot of podcasts. That's all I'm going to say. I signed up to newsletters. Whatever. I read Good to Great. I did the best I could. But we got this grant, and then we got another grant, and non-dilutive funding for young entrepreneurs. It was amazing. And, then we explored the VC round and did pitches, and I didn't even know what a pitch was. I was just talking to people, and the next thing I know, people are offering money and I want a piece and they want a piece, and people are fighting. And it was just really, it was reassuring, because I realized that it wasn't going to be a resource problem. It was just going to be, can we get the job done? Can we create software to automate Alzheimer's prevention care, having a neurologist in your pocket? And what we've created over the last several years is what we hope will be the first digital therapeutic for risk reduction for Alzheimer's disease or Alzheimer's prevention.
So how is that going to work?
Yeah, so we're excited. The clinical trial is launching very soon. Not sure when this will air or when this will be whatever, but maybe you're listening and it will be already going. But the yourbrainstudy.org is the site, or retainyourbrain.com is basically the place that anyone can go right now to really learn about brain health and participate in the first online decentralized clinical trial for Alzheimer's prevention. Amazing. And what this software does is it basically learns about you. It uses aspects of artificial intelligence. It does a risk assessment. It learns about you. It then does cognitive assessments through what feels like games. It's card tests and other things, but it's validated. It's real cognitive assessments. It's not just like, silly games. And then it really gets to know you and gives you a risk score, and then tells you what your highest risk factors are for cognitive decline and educates you about different things. Now, it gets to know you over time. It takes, it could take a couple months, and you interact and you text back and forth, and it's like you're interacting with a virtual Alzheimer's prevention neurologist. And that has been our goal. And we're launching a 6-month clinical trial. And we hope to understand, can this digital therapeutic move the needle? Can it improve or maintain cognitive function? Can it, and this is all, again, just through the comfort of one's cell phone. There's no cost. You just sign up. It's all free. And basically, can we reduce Alzheimer's risk, and can we improve cognitive function? And in a subset, this is the expensive stuff, unfortunately, or better for worse, about 20% of the cohort, we're going to be getting blood tests. We're going to send a phlebotomist, a mobile person, to go assess blood markers. We're going to store the markers in a freezer, and we're going to check in the blood. This is pretty cool stuff, amazing stuff. I can't even believe this is actually possible, but it is. We're going to be checking what I'm trying to refer to as the cholesterol test for the brain. Everyone's heard of HDL and LDL and triglycerides.
My blood pressure is this, my heart rate's that, but
these are markers specific for brain health, exactly. And we're going to check amyloid in the blood, and tau, and something called NFL, which is neurofilament light, a marker of brain degeneration. And we're going to track these things. And if someone's interacting with the software, we're going to learn about their risk, and then we can actually type in if you have an ApoE4 variant, which is another genetic thing, and give personalized advice. And basically, we're going to track, can virtual care, can a digital therapeutic actually not just improve cognition or reduce risk, can it actually have an impact on the actual pathology of the disease? Can it slow neurodegeneration?
Right.
That's the holy grail here. And if we can do this in a cost-effective way, we just actually, that last week, submitted another grant to the NIH. Cross our fingers. Won't find out about this for a while. We're going to try to translate this into Spanish. We're going to try to reach underrepresented populations. And we're going to also add additional artificial intelligence components, because that's where this field is going. And we need to, between generative and emotive AI and conversational AI and meta prompts, like, we can really make this feel human, and sometimes it may work better than a human.
Right.
This has been shown with some AI.
Well, you're talking about two things here. You're talking about slowing the cognitive decline, but you're also talking about improving overall cognition, improving one's brain.
Yep.
I mean, those are really two different things. I think I'm probably in the camp that I need the improvement very much.
or the brain transplant.
Hard living founder. Yeah, hard living founder. Right. Yeah, I felt a lot of pain along the way.
Yeah.
Can both be achieved?
So let's start from a data-driven perspective, because I have to stay in my science lane. So in 2019, we published a really impactful paper, and really kind of all those tomato throwers, they ain't throwing tomatoes no more.
At you anymore.
Which is good. And in that study, this is before the days where we had blood tests where we could monitor and evaluate over time, over 18 months, what happened to the amyloid and tau. We couldn't do that back then. We couldn't quantify it. We could tell if it was there, but we couldn't compare changes. So
Got it.
In a study we published in 2019, we showed that people with mild cognitive impairment, so people with the earliest symptomatic phases of Alzheimer's, with amyloid.
Just what does that look like for people? What is the earliest? I'm forgetting something.
Yeah, I'm still working. Yeah. CEOs of companies, truly, like high functioning people, driving, paying the bills, whatever. Just some glitches.
Okay.
But the glitches are not interfering with their activities of daily living. They can still do all the things. So in those people have followed greater than 60% of the recommendations that we gave. Now, that wasn't automated recommendations. That was one-on-one doctor-patient relationship. Those people actually had better cognitive function 18 months later. And they had lower calculated, when you put the numbers into the calculators, Alzheimer's, dementia, and cardiovascular disease risk.
Wow.
So that, and also you improve some cholesterol and improve insulin resistance. So that was a really important study, because back then, this is before there were any drugs approved for mild cognitive impairment.
This is following your protocols, personalized for that individual for a period of time, that were protocols that were accessible but had to be personalized for that person.
Yeah, and each person on average got 21 different recommendations.
21.
From an overall universe of about 50 separate recommendations that were recommended at least once. Each person on average had 21. Now, for mild cognitive impairment patients, they had to follow a lot of them.
Yeah.
The people that didn't continued to decline. The other reason the study got press and CNN and Wall Street Journal and all this silly stuff, but it was amazing because the group that didn't have symptoms, so the people in their 20s, there's a group of people aged 25 to 89. It was a large group of patients. And it was the people that had no symptoms. They may have had a little amyloid in the brain or no amyloid in the brain, 20s, 30s, 40s, 50s, 60s. Average age was 50, 51. And in that group, whether they followed 60% of the recommendations or less than 60%, all groups either stabilized or improved their cognitive function. Wow. So if all groups improved or stabilized cognitive function, that means that we did something. Now, can we say that we reversed disease, or can we say that we stopped neurodegeneration? Well, no, we don't have the biomarker data. But this next phase between the digital therapeutic and this amazing advances in blood testing technology, now we can finally prove this or not.
All right. So in these moments when the elder states people are saying, who is this kid that is talking about vegetables and stuff instead of talking, and to someone in their 30s. Yeah. And so you're really knocked down.
Yeah.
Founders have a really hard time in these moments, and it happens to all founders. Yeah. What was the thing going through your mind at that point that said, this is how I'm going to keep going. This is why what I'm doing is so important that I need to keep going, and this is how I'm going to keep going.
Yeah, I mean, I've needed a couple of these moments or several of these. I continually need these moments because, you know, in this work, 99.6% of all Alzheimer's disease clinical trials have failed.
99.6%. Yeah. So if there were another way, you have a 0.4% chance of success.
Exactly. And, you know, and we were one of the successes, and that is amazing. Yeah. And that was a great, you know, nadir in our work. But there have been many low points, and I'll be very frank. There's continual low points, and it's not easy. Yeah. Reagent shortages, meaning like, you know, we don't have the chemicals to run the samples. Yeah. What national, global, whatever supply chain, well, it affects us too. There's been a lot of stuff, but you know, so I guess what I would say is, I was there was a story being done for the Wall Street Journal back in like 2014, and the reporter came in, and we're doing a story, and it was a patient with early onset disease, and it was a woman in her 50s, and the son was there. It's a little different because actually the majority of caregivers for people with dementia and Alzheimer's disease are the eldest daughter or daughter. That's just the way this kind of goes, and it was a little atypical, I think, for the reporter maybe to see a son, that was there. Yeah. Okay, maybe that was part of the story, but not necessarily. And so we met with the patient. It was a tough story, early onset disease, a young, vibrant, amazing woman. And at the end, they switched seats. And the reporter kind of gave a funny look. And then Max Lugavere, who just an amazing guy, and he's now actually taken on brain health as a part of his professional journey because of what he's been through. And they switched seats, and Max became my patient for prevention. But his mom, Kathy, was
interesting.
My patient for treatment. And I think the Wall Street Journal reporter said, "What?" And that was a different moment. And what happened, weeks later, my phone blows up, and I've had people text me, or I'll do a TV thing, and Facebook, okay, whatever. Yeah. This was different. Our phones rang off the hook. We had 49 new patient appointments in 48 hours, and our phone answering machine got full. And it was a story that came out in the Wall Street Journal. It said, kind of like alluded to what you just said, Alzheimer's prevention for 30-somethings with no symptoms. And that was the moment. Right. Because, I said, wow, I've been doing this, and I've been pushing, and I've been fighting, and I've been begging and pleading, and now it's real. Now it's in print, in the Wall Street Journal, and everyone's hearing about it. And I said, this is going to catapult me. This is going to get me through the tough times. And my God, there were tough times. I can guarantee you. We had a grant; it was coming in, and we got funding. We got the letter, and then September 6th, 2017, I got the letter saying the funding has been reallocated. That was a tough time.
Oh yeah.
I was about to hire 3 new people.
Was that the hardest? What was the hardest moment of your career? Because you're playing such a long game. Mm-hmm. And so many founders give up. This is what happens to people: is there just too many hits, and I feel like enough. I can't do it anymore.
As a newer founder and an older researcher, or younger / older researcher, I have, I guess, felt it on various sides. The Silicon Valley bank implosion was a very hard moment, but that all worked itself out and everything. That was
But
a
scary moment,
scary
for sure.
learning experience.
Yeah.
But there's some tough founder type stories. But from a science perspective, we were like literally in the thick of running our research trial. We still had a few months left to collect data. Our big, kahuna funding was coming in, and it was pulled at the last minute. And we were 3 people in the hopper. We were interviewing, about to give job offers to another PhD. We were going to scale. We were going to do this. Statistics, we were all ready. We had 3 months left, and we were going to analyze the data. And then the money's gone. And I had to, first of all, pull the 3 offers, and we had 31 people at the time. We had to downsize to 24 people. That is a very tough thing to do. From 31 going to 34 down to 24.
Yeah.
I don't know if maybe that sounds like a lot. Maybe it's not. For me, it was
the most difficult moments in my career. Also, when you have to let people go unexpectedly, especially not planned. Your family,
who I care about.
These people become like family.
Yep. And these are like students applying to medical school, and how do you lose a job that looks bad on their resume? We had crying. We had whatever. And it was also, I didn't have as much control. I was an employee of an academic medical center, and I couldn't do anything.
Yeah.
I also didn't have a budget that I could then say, oh my gosh, I'm so sorry. Let me do something. Now I can do that. Now I have, resources. I make decisions, and, it's totally different. But September 2017 was really bad because A, we hadn't finished the study yet, and B, we had no money to do statistics, and C, my team was completely gutted. So getting through that was tough. And I guess, I don't know if I'm the right person to be giving advice to first-time founders, but I guess what I would say is you got to just hold your head up, and then, take a deep breath. I walked around the block, I walked around the block again in New York City on 71st and 1st, with my hands on my hips. And I said, I got to figure this out.
Yeah, when you did that, having such results, though, having helped so many people already, I mean, there's conviction around what you were doing was having a positive impact on people and was leading to great outcomes for the future of humanity, really, right? Yeah. But in the moment where you just don't have the money to pay the next bill, that is a really difficult thing. But every founder faces it. So I don't think that you should think anything other than walking around the block may have been what needed to happen.
I stopped on the corner of 71st. I remember this like a video in my mind, right? 71st in New York. And I was staring at Sotheby's, and they have a coffee shop, St. Ambrose. And I just took a deep breath, and I said, I got to go back. Time to roll up the sleeves and do it again. And I was not ready for that. I wasn't ready to build. I'm a builder. I'm a creator. I enjoy that. I'm a team. I love creating teams with good, chemistry. And I said, I need to go back into building mode. And this delayed our results by over a year.
That's painful.
That was painful because we could have published this a year early. We also published this in November 2019, and then about 2 or 3 months later, what happened? Our world got all screwed up. So, I guess I would say it was an important learning experience. I deal with problems differently now because of it, but you just got to pick yourself up off the floor and keep moving forward.
Along the way, when you're doing the decades of research to get 2 decades of research, then you're continuing to do it. Mm-hmm. If and when you went down the wrong path or you thought might not be the right path, how did you course correct?
As I've learned from my detailed studies using podcasts at the gym, you have to know when to pivot. I've been very conservative with the pivoting because, when you keep your eye on the prize, that's when you're more likely to succeed. And the more you take on, the more diluted you get and the scarier it gets and whatever. So I guess what I would say is I've tried to keep my eye on the prize as much as possible and not get distracted by the new shiny object that I want to move towards. That being said, occasionally you have to take risks. And, right now, actually, in our research, I was going along and everything was good. And, and then with the digital therapeutic study, we're getting blood tests and we're sending mobile phlebotomists and we're, launching the clinical trial, and everything's great. And then I saw a new shiny object and I said, I have to go for it. That's
always dangerous.
It's always dangerous. And I don't know the outcome yet because I'm in the midst of it. But if we can, pivot towards at-home testing and not having to figure out how to send a blood draw person and send samples on dry ice. And I said to myself, if we can figure out a solution for at-home testing, That's how we're going to scale this. That's how we're going to help the most people.
Right.
And
That's how you make it accessible. That's how you democratize it. So how is that going to work?
What we are pivoting towards is an at-home solution that will be the key that unlocks the door to the masses. That's what I believe. And blood tests and blood draws, fine, everyone gets blood draws, but there still is a barrier to blood draws.
Yeah.
The further part that complicates blood draws is the types of tests that we do needs to be frozen on dry ice and mailed internationally to different sites.
Logistics nightmare.
So logistics are challenging, and the costs and whatever. For example, Chris Hadfield, was having a nice conversation with him. He corrected me. I said, if we do this, we can reduce costs by an order of magnitude. It's actually two orders of magnitude because when we do all the math between processing the samples and the shipments and this to St. Louis and here and whatever.
Well, and just error rates too. I mean, you can just imagine like logistics breakdown.
GPS tracker. A hurricane came last year and this shipment sat in Newark Airport and we had to send someone to refill the box with dry ice. It was completely cuckoo. But like that was like about $10,000 per sample per time point.
Per individual.
Per individual per time point.
Okay, so completely not scalable.
No.
$10,000 per individual. Yeah.
Not at this time. Because again, we're still in discovery mode and figuring out which of these are necessary. Like, do we really have to send it all these places? 2 orders of
magnitude means $100.
$100. And we are now for the first time getting the first access in the United States for a finger prick test. And no, this is not Theranos. This is not a little dot. And this is not, there's a lot of, it's a loaded thing.
There's some scar tissue from that.
We're all scarred in some ways. Now, is this going to be perfect? I don't know. We still have to validate. We still have to do the blood draw and do the finger prick card. Right. But if we can truly prove that the finger prick is valid, this is how we democratize care. Yeah, because I think when people start realizing that you can take control of your brain health by making brain healthy choices and seeing your doctor and doing X, Y, or Z, when people realize that, then the fear will lift and the empowerment will rise up and people will want to take these tests. And I think it's going to take a year or two to kind of get these out there and validate it for sure. But the fact that we're talking about finger prick testing and I just can't even believe it's like science fiction, but it's real. And I think this is what's going to be the key to unlock the door. Yeah, the
proverbial hockey stick starts. Well, what's amazing to me, it's shocking to me actually, is that many people don't actually want to know what their cognitive profile and their cognitive future looks like. Yep. I mean, we all want to know whether we're going to have a heart attack or not. We all want to know whether we're going to have cancer or not. Yep. But so why is there so much fear around knowing about what's going to happen, especially in the context of, hey, there might be something you can do about it, thanks to Richard and other progressive leaders in the field. There may be something to do about it. How come everyone doesn't want to know?
Yeah, I mean, so fear is paralyzing. And I think from my perspective, I've seen a lot of people, not just family members, but people I care about, my patients, suffer and the families suffer.
Yeah. Likewise,
Yeah. And, I guess what I would say is, cancer is terrible and cardiovascular, heart attack is terrible. But with heart attacks, a lot of times you just go and it's a quick, painless.
My father went that way. Yeah.
Yep. Exactly. Yeah. And I don't know, maybe that's part of it. But when you see the suffering and the pain, I think you just don't want to know. And I think it's indoctrinated. The dogma. I mean, doctors, the vast majority of doctors, if surveyed, I don't know that I can't quote a survey, but 80 to 90% of physicians, I bet, would say there's nothing you can do.
Right.
A lot of people don't even treat people with dementia and say there's nothing you can do. What do you mean? We have several FDA-approved drugs and infusions, and none of them are miracle or perfect drugs, but we can do something. Yeah. So I think what we need to do first is kind of change the landscape of understanding, change the conversation, whether it's through online education, through podcasts like this, through media, through a digital therapeutic that's available widely, through software. Change the conversation, develop the technology in parallel, not in sequence, because we don't got any time. Right. We got to do the technology now. We then commercialize it, get it in the hands of the public, have the tools that can be disseminated, and do it in a way to reduce costs, increase access, and that's how we make the impact.
We're going to, it looks like, in the next 10, 20 years, maybe 30 years, but probably in our lifetime, solve cancer, largely solve it. Cardiovascular disease, certainly diabetes, it looks like, we're well on the way, for these things. Brain seems far away. Is that what's contributing to the fear? Is that it's maybe a never can be solved problem? Could that be contributing to it?
Well, I would say that,
So it's like an awareness thing.
Yeah.
That stuff like you're doing, your research and the promise it's showing is what people just need to learn about.
yeah, to be honest, I think brain science is probably 15, maybe 20 years behind cardiovascular disease. We've made, leaps and bounds in cardiovascular disease. I would say cancer, we've done well in some areas, but in
still
other
a lot of it
areas,
is
we
still
still,
very
there's certain
deadly.
cancers
Yeah.
that just,
Deadly.
they
Yeah.
come and then
Yeah.
it's I would say it's over, but it's, wow, like there's almost nothing you could have done. But so I would say that Alzheimer's disease and other neurodegenerative dementias are a solid, even Parkinson's disease. We're behind the curve with some of these other, chronic diseases related to aging. But I don't know. I guess what I would say is the data shows that something proven in medical science takes 15 to 20 years after it was proven to permeate into routine clinical practice and care. So I think the problem is we're 15 years behind in the science.
Right.
And then it takes 15 to 20 years.
Yeah.
So the goal, I think, of our work, and we can't do everything, but we can do the best we can, is that while we're proving this stuff works, while we're developing the tools we need to track outcomes and diagnose, at the same time, we have to disseminate education widely and disseminate it far and wide. And if we do these three things in parallel, maybe we can cut down that 30-year time course to 15 or 20 or even less. And that's the only way to make the most and the quickest impact.
Brain matters the most because, at least for me, I'm trying to live to 120, as you know, and I'm trying to get you to help me to do that.
Working on it.
And so most likely brain is what, if we get past the other three, if cardiovascular, diabetes, and cancer, then it becomes brain. Do you envision a world, from what you can see today, where we have conquered this and someone's cognitive profile throughout their life is really within their control?
That is a tough question. There is tremendous heterogeneity in brain diseases. And what I mean by that is there is, people say Alzheimer's, but it's like could be different diseases that get lumped under. Dementia is an umbrella term for different conditions. And what I would say is, we're making progress with Parkinson's disease. We're making a lot of progress with Alzheimer's disease. We've made good progress with vascular dementia, which is, kind of high blood pressure, high cholesterol, diabetes. There are some conditions that I don't think we're there yet. There's a condition called dementia with Lewy body that I'm really trying to push forward on, but I only have two hands and a small team, and we do the best we can. But definitely behind. Frontotemporal dementia, that's a tough one. Frontotemporal dementia, there's genetic causes that we're going to really have to get ahead of these things, and we don't even know how to even start with some of the
gene
genetic
therapies. Is this is this the direction we're going?
We're far away. We're far away. So what I would say is we're going to be able to kind of check the checkbox that we can do. If 4 out of every 10 cases of dementia are preventable today, if that person does everything right, and that's actually based on data from a few years ago. So let's just say we're 50%.
Yeah.
Today, let's say we're 50-50. I don't know, in a few years we'll be at 60%. And a few years later we'll be at 70%. But one of the tenets of our program, and we talk about this sometimes and we write about this, is we promise not to overpromise. I think too many people out there say, the panacea, or,
the miracle drug. This is it.
Exactly. We are really conservative. Like, this is something I actually haven't talked about publicly. I talked about in lectures. I gave grand rounds at Harvard Medical School, at Mass General Brigham a couple months ago. We now have this pre and post data where we have amyloid and all these proteins that we track in the brain. 4 out of 19 cases that we've seen so far have lowered amyloid and tau, the bad proteins that characterize Alzheimer's, lowered it sufficiently to where the person no longer meets pathologic criteria for Alzheimer's disease.
Where they were before.
Yes.
Wow.
Yeah, and I had never seen this before.
Wow.
People I've been talking to in lectures had never seen this before. But I'm not calling it that we prevent it. I'm not saying we reverse. No way. I don't know what's going to happen to these people in a year or 2 or 5 years. Yeah. So we're going to be really conservative until we really know. But heck, if we can actually have this type of an impact, I think the impact on public health is going to be tremendous. Quality of life, tremendous. I think the brain is really the essence of who we are, and we have to protect it, and we have to keep moving forward.
Thanks for listening to this episode of Trailblaze. Would love to hear from you. Tweet me or comment on LinkedIn or Instagram and share what you took away from this episode. This show was produced by Creator Club Studios. You can start creating today at creatorclubstudios.com.